When we decided to implement remote care, we approached payment by offering options for our patients. We have some educational materials that really outline the costs and whether it will be covered by insurance to the best of our knowledge. And we also guide the patients on how to explore this with their own insurance. And then in that same educational material, we provide information on what the out-of-pocket cost would be. And our institution offers a cash pay discount to patients, so that can also help offset some of those expenses.
At Michigan Ear Institute, we both charge patients for their remote care and we seek reimbursement via insurance. It simply depends on what service the patient has had. So remote check, patients do private pay for that, but remote assist, at this point in time, we're able to use an insurance code and get reimbursed via the patient's insurance.
When considering how to offer this service in our clinic and the financial perspective, we absolutely spoke with our teams and we had to dive into the value that audiologists bring, our time and our expertise, and we did have to convince our team that their time has value. And so if we are providing a service to one of our patients, regardless of the medium that it's through, we are to be reimbursed for our expertise, just like I would be with any other provider or any other service that's provided to me if you're getting the same quality product, be it through a different medium.
When we were debating what to charge for remote care services, when we looked at our current billing charges, we decided for remote assist, we were going to offer it at approximately half the cost of an in-person appointment. The reason we decided on that is because the appointment time is approximately half the cost. So we felt that was a fair and reasonable charge. For remote check, being that it was asynchronous, we had a little bit of a harder time deciding what to charge patients. So quite honestly, we started asking patients what this value would be to them, and then decided on a number that was pretty much exactly what our patients have said. Because of that, our patients had really early buy-in into remote check and into remote assist, and we have thankfully not had any difficulty with patients paying for their services. They see the value in the services.
As we've been implementing remote care, one surprising aspect, at least for cochlear implant audiologists, is that people are willing to pay for this sort of care despite the reimbursement challenges. A lot of what is provided for cochlear implant care is covered by insurance when you compare it to hearing aid care. And so I myself was a bit skeptical at the beginning of whether people would really be willing to pay out of pocket for this sort of service. And surprisingly, especially when we walk people through how much they're paying in gas, the time off they may have taken from work, and all of those extra factors that add up, people really see the benefit and are quite open to paying out of pocket, even if insurance won't cover it.
So when providing remote care, we do not charge for the remote check component. In Australia, we're quite fortunate where we can get reimbursement for the remote assist or telehealth portion.
What we found is even though we can't get that reimbursement through the public system for the remote check, the clinical efficiencies that it gives us, so we can review, say, up to 4, maybe sometimes even up to 6 remote checks in an hour. The clinical time that saves for the extra appointments that we can see, for the more recipients, getting new candidates in the door, it hasn't affected our revenue and our reimbursement by not being able to do that. Obviously, we would love it if the codes improved and what we could reimburse through the public system, that would be eligible. But we haven't seen a decrease in our revenue by not being able to charge for the remote check. Remote assist is reimbursable for us in the public system in Australia, and the way that we do our billing in the centre is it's the same value face-to-face as remote assist, so there's no difference there in the reimbursement.
Telemedicine is going to continue to evolve in the environments that we live in the global world. And as we see that shift, and as we continue to get affirmations from our patients that they potentially prefer care this way for a number of reasons. And as we also continue to demonstrate that patients can reach the same quality outcomes as those who come into the clinic by using these tools, I do absolutely think that reimbursement will change for these services. I also highly encourage any audiologist who have a platform, who are willing to take a platform, to advocate for your services specific to telemedicine.
I'm hopeful that reimbursement for remote care in Australia will increase over time as the government bodies and the public health system understand the technology more and the clinical value that it gives to us, even though it is asynchronous for the remote check. I think once we can get that understanding, then it will improve over time. I think telehealth is here to stay. It wasn't a temporary thing with COVID. So I think that it will increase for us over time.
I believe over time, reimbursement for remote assist will increase because when politicians and insurance carriers and the people that make those decisions on reimbursement hear from the patients how valuable this is to their health care, I think they will also recognize the value and increase the reimbursement over time.